Acidity, acidity, acidity. Nowadays we are getting too many patients saying that I am having acidity. Most of the times they might have taken the home remedies and treatment. Treatment like nowadays PPIs are very commonly available on the counter in the pharmacy, and they might be taking it for years together. So one person came, he was asking, sir, what is GERD and what is hyperacidity? I think we should break the myth between this hyperacidity and GERD, and I think we should educate the people that they should not be taking it lightly, hyperacidity, and they should get it evaluated if they are suffering it from many years.
GERD is totally different from hyperacidity. As I've told, GERD is gastroesophageal reflux disorder. So normally what happens, whenever we eat food, drink water, it comes from food pipe and it goes to the stomach. And in stomach it stays for some time, like 2 hours or 2.5 hours. Then it goes to the intestine. Stomach secretes an acid called as an hydrochloric acid. So never will the food go back upwards from stomach to the esophagus. It is a one-way valve. When this valve becomes weak, the valve won't close completely. So when it doesn't close completely, the food or the content in the stomach will come up. It is called as a reflux.
So let's discuss that what are the symptoms that what we can call as a hyperacidity, and with what symptoms the patient should come to you with the GERD.
In GERD, what happens is there is heartburn, there is something called as a regurgitation, then there is bitter taste in the mouth and abdominal bloating, and sometimes they feel like nausea, like vomiting sensation. So these are the most common symptoms of GERD. Now coming to hyperacidity. Hyperacidity is increased hydrochloric acid secretion from the stomach. Which causes burning sensation in the abdomen. That is hyperacidity. So to be honest, when the valve becomes weak, the stomach contents will come up into the esophagus, into the throat, into the mouth, sometimes into the lungs also, which most of the time is misdiagnosed as asthma. I have seen patients going to dentist because of acid falling on the tooth, they develop caries. So they get the tooth removal, but again the caries develops.
The root cause is
GERD. So whenever they take medications, they are fine, absolutely fine. When they stop medications, they start experiencing these reflux symptoms again.
But when you are having a retrosternal burning,
correct,
a bitterness of mouth, something is coming back into mouth while sleeping, and few people will be experienced due to microaspiration, some cough in the night, dental caries. If you are having these symptoms along with this acidity, what you are saying, so I think you should be getting it evaluated that whether are you suffering from GERD.
See, the most common way to diagnose is, one is symptoms of the patient. Second, we have an objective way of diagnosing it. How to prove it? The simple test to be done is an endoscopy. In our setup at Kauvery hospitals, we know that we have a very good medical gastroenterology team. Endoscopy is done within 5 minutes. With what does endoscopy show? Endoscopy shows how much of esophagus is burnt, how much it is damaged. We call it esophagitis because of acid reflux. Basically, the root cause we know that it is sphincter which is weak. See, now patient is on PPIs. That is proton pump inhibitors. They have taken all these tablets for a long time. We know that the acid secretion from stomach is decreased. The reflux is happening, but acid is not refluxing because acid itself is decreased. So they don't see burn in the esophagus by endoscopy. Endoscopy will be negative, but patient complains of symptoms. Now how to diagnose this? Patient will ask, sir, you are telling GERD. But endoscopy is normal.
Exactly.
There is no burns in the esophagus. But I am having symptoms. So these are called as endoscopic negative GERD. So for them, the gold standard test to prove that it is a GERD is something called as a 24-hour pH metry.
But as a doctors, we can say there is something called as esophageal manometry, which usually will be done in the GERD. So when it should be done and why?
Esophageal manometry is a separate test which shows the motility of the esophagus, how the esophagus moves. So it is normally used to diagnose motility disorders of the esophagus. But sometimes what happens is patient will have atypical symptoms, and some motility disorders of esophagus also present with heartburn. They will also have symptoms of refluxes. So whenever you have a suspicion that this patient may have motility disorders of esophagus, then you have to do a manometry also. Otherwise, routinely it is not required. The most common test required is endoscopy. If endoscopy is only negative, or patient have some atypical symptoms, or they are not feeling well in spite of taking this proton pump inhibitors or tablets, then 24-hour pH metry is indicated. So, patients with GERD, no home remedies, no long-term treatment with medicines, not all require surgery. Please consult us. We are there to help you out.